Good morning, everyone. Now we'll be discussing about some strategy tips for scoring higher in the OET speaking part of the examination. Let's start with today's lesson. The OET speaking test is a face-to-face examination between an interlocutor or examiner and you. Your speaking test will be specific to your healthcare profession. In the speaking test, you will complete 2 role plays where you take the role of the healthcare professional and the interlocutor takes the role of the patient, the carer, or a family member of the patient. So in the examination, you will have the examiner in front of you. He or she will tell you the procedure of the exam, and she will give you a card in which you will have the scenario of the role play written. So you will be the doctor or the nurse or the dentist according to your profession, and the examiner will pretend to be the patient or maybe a relative of the patient. And then according to the card, you will have 5 minutes to convey your speaking examination conversation. The fluency is important. The purpose of this exam too is to check how well you communicate with your patient. So let's see an example of this examination.
So let's move on to the role plays now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. Each role play will last 5 minutes. The purpose of the role play is to get evidence of your ability to communicate effectively with patients.
So here she says, the purpose of the speaking examination of OET is to see how well you communicate. The purpose is not to check your medical knowledge. So even if you don't know much about the scenario they will give you, that's not a problem. They are checking how confidently and how effectively you can communicate with the patient. And here, she will give you a card and then you will get 3 minutes to prepare. She will give you a pencil and then you can underline the words and you can write about what to ask the patient. After 3 minutes is over, you as a doctor or according to your medical profession, you will ask the patient or the relative question and the examination will start. The conversation will be for 5 minutes. Even if the conversation is not over, after 5 minutes, the examiner will stop you because the purpose is not to get a complete conversation. The purpose is to check your empathy, your fluency, and your confidence.
Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
Okay. You have up to 3 minutes to prepare the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. This is your information for the first role play. It's role play number 1 for medicine. Please start preparing now.
So now she'll be given 3 minutes to prepare her conversation, speech, and the questions she will ask to the patient.
Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Sure. May I just confirm your name and date of birth, please?
Certainly. My name is Rebecca and my date of birth is the 15th of March, 1978.
Thank you, Rebecca. I understand that you have just been discharged.
So here, the patient, the student, the doctor, the student who is playing the role of a doctor is asking the patient the name to confirm the name and the date of birth. That is very correct, but at first she should introduce herself. I am doctor this and this. How can I help you? Can I confirm your name? So she did this small mistake. She didn't introduce herself. Please remember to introduce yourself. And then she's asked that, I understand that you have this and this. So that's how she's starting this exam.
Can you start the role play, please?
Sure. May I just confirm your name and date of birth, please?
Certainly. My name's Rebecca and my date of birth is the 15th of March 1978.
Thank you, Rebecca. I understand that you have just been discharged from hospital 2 weeks ago. Is that correct?
That's right, yes.
That must be very difficult for you.
Yeah, I'm happy to be home and I'm feeling much better than I was 2 weeks ago, but I am feeling really quite tired and I'm a bit worried about that.
Sure. Can you tell me a little bit more about the treatment? I understand that you had a mild anterior acute myocardial infarction and then it was treated in hospital.
I had a heart attack.
Yes.
And yes, I was in hospital.
Did you have any procedures? I'm trying to understand whether you had any surgeries or you had...
So here, the patient, the doctor told that, I understand that you had a myocardial infarction. So myocardial infarction is not something everyone knows. It's not used commonly in the community. So it is a medical term. Try not to use medical terms which a normal person other than the medical profession would not understand. So use the term heart attack. For example, for the term hypertension, use the term high blood pressure. You have to communicate at the level of the knowledge of the patient. So this is another mistake we can do, because unknowingly the word can be very common to us but not the patient. So we have to speak in the common terms used in the community.
That made me feel better.
Right.
And they hooked me up to some machines. Yeah.
Right. So the tiredness became 2 weeks ago when you returned home from hospital, is that right?
Yeah, I suppose after the heart attack, I expected to feel tired, but the tiredness hasn't gone away. So I feel quite anxious that maybe this is the new normal for me.
Sure.
That I'm always going to be tired.
Sure. Are you getting enough sleep at all?
Yeah, sleep, maybe not quite as much sleep as I did before the heart attack, but yeah, pretty good.
How many hours on an average work day?
Well, I like to have 8 hours sleep every night, but I think I'm waking up maybe once in the night at the moment, so it's not complete 8 hours.
Sure. How long does it take you to go back to sleep if you're woken up during the night?
It can take a while.
Right.
Depends if I've got something on my mind.
Sure.
I put the radio on. That helps.
Yeah. And before the heart attack, you never felt like this?
No.
No. So this is
And
new.
the heart attack was completely unexpected.
Sure.
So,
Yeah, understandable. Well, in hospital, they would have done all the necessary investigations to exclude any underlying or unrecognized illness that would be contributed to your tiredness. So let me reassure you that this is purely due to the normal bodily reactions once the body undergoes such an event as heart attack. So it is normal that you will be feeling a bit tired for the next few weeks, but eventually we are expecting that your full energy levels will return.
So here you can recognize in the voice of the patient there is empathy. You have to be empathetic towards your patient. The patient just had a heart attack, so you have to be very empathetic towards the patient and you have to assure her that you understand her pain, and also do not use a monotonous tone and do not speak like you have memorized the speech, but you have to speak like at the moment what you're hearing, responding, not monotonous. You change the tone of your voice according to the feelings of the patient. If they're explaining about some trouble they're having sleeping, you say, yes, I understand. So this patient's empathy and the level of communication is very good.
tiredness. So let me reassure you that this is purely due to the normal bodily reactions once the body undergoes such an event as heart attack. So it is normal that you will be feeling a bit tired for the next few weeks, but eventually we are expecting that your full energy levels will return.
Oh, okay. So this isn't going to be like this forever?
Absolutely not. And that is why I would like to address something else with you that will help you with not feeling tired for a long time. It is called Cardiac Rehabilitation Program. Have you heard about that?
I think they mentioned something about it in the hospital, but because they talked about walking and swimming, I didn't think that was such a good idea because I don't want to have another heart attack.
Sure, yes, absolutely. Well, cardiac rehab is all about graduating that necessary exercise levels that you would be able to tolerate, that you would not be getting any chest pain or what we call ischemic pain, that is what causes the heart attack. And by graduated exercise, the circulation in your body will improve, and that will not only make
So here, in this part of the conversation, the student is hesitating a little. She's using the word a lot. Try to avoid those as much as possible. Like that shows that you are not thinking fast enough, and you don't try not to use those words like okay, so try to avoid it.
Not only make you less vulnerable to ischemic events, but it will also improve your overall feeling about yourself, as well as the very
See, it's very obvious. She started laughing at a point. She doesn't know what she's talking about. So this is a bit downfall. You have to avoid doing this. Keep it short. It's okay. Remind yourself, even if you don't know about the procedure, your job there is to be fluent. So keep it short. If you don't know what to say, finish the sentence there, but do not elongate it with, I don't know, like, if you don't know what to say, then cut the sentence short.
Just by being able to exercise, you would not be feeling tired as you're feeling now.
Okay, I do worry though. I mean, the doctor said if I had another heart attack, it would be more severe. And because I'm feeling so tired, I do worry that doing exercise is going to make me more likely.
The cardiac rehab is guided and coordinated by physiotherapists who are trained into this field, and that's what they do. They're experts at rehabilitating people who have undergone the same problems as you have, and are recovering from a heart attack. But on top of the exercise, we do have to address a few other things, and that is the other contributing risk factors to developing another heart attack. Please don't worry about that, because if you change your lifestyle, your chances of having another one are quite low, especially if you find ways to maintain normal levels of cholesterol. And losing weight and strengthening your heart, as I said, by graduated exercise coordinated by a cardio rehab physiotherapist.
Thank you.
Yes.
That's the end of the role play.
You see, the role play was over. She was thinking of something else, but when it's 5 minutes is over, the examiner will stop you. So this was a good average kind of examination. We spoke about the mistakes. So let's talk about some strategies which will help you to have a better and excellent examination. So here is an example of a card which your examiner can give you. So here is a medical task. In the card they will write, a 44-year-old patient has been referred to your clinic due to high cholesterol and hypertension. They are frustrated about attending today. So this will be written in your card. Then they will give some points which will help you to to plan about your conversation. So the first bullet point is to find out what the patient thinks the purpose of the visit is today. So you have to ask about these. You have to ask some questions about the purpose of the visit of the patient. Second bullet point written is, explain the implications of high blood pressure and cholesterol on current and future health, like strokes, heart attacks, kidney damage, etc. So in part of your conversation, you have to explain what high blood pressure and cholesterol, if the patient continues to have these, what can happen in the future, like if the patient is more prone to strokes, heart attacks, or kidney damage. The third bullet point, discuss the cholesterol-lowering drugs and antihypertensives and explain their benefits. So here, even if you don't know the details, you can talk about it. They won't judge you according to your medical knowledge, but they just need you to know how fluently and easily you can talk about this. You just talk about the medicines, about cholesterol-lowering drugs, statins, antihypertensives, and why the patient should regularly and take the medicines on time. And then the fourth bullet point, find out about the patient's lifestyle, example like smoking and drinking habits, and advise the patient on how to improve his or her health, like reducing smoking and alcohol consumption, joining a support group, or seeing a counselor, or increasing exercise. So you talk about the medicines, you talk about the health implications, and at the end of the conversation, talk about find out about the patient's lifestyle and give some advices, what changes he should bring to the lifestyle. So this is pretty basic. They're not asking detailed medical information, but they want a good quality conversation with the patient. So now we'll talk about some strategies you can use during the examination. Treat the role play as if you were with a real patient. So at first, you have to think it is a clinic, I am a doctor, and this is a real patient with real complaints. You have to make yourself believe it for that 5 minutes. Allow time to establish a relationship with the patient and ask for relevant information. So you have to establish a relationship with the patient and then ask the relevant information. Remember that the assessor is testing your ability to communicate. So this is important. They're assessing the ability to communicate effectively with patients in English. They're not testing your medical knowledge. So even if you don't know some words in the card, even if you don't know the details of some of it, do not panic. As long as you can speak confidently and fluently in English, there is no problem in getting high score in this OET exam. Pay attention to the type of information you need to communicate to the patient and adjust the way you communicate this information for different situations. If the patient is being given bad news, for example, you should show empathy and kindness. So it is one of the etiquettes of a doctor to show empathy and kindness when giving a bad news, or if the patient is telling something sad about her disease or the illness, you must be kind and empathic, and your voice tone should change accordingly. Don't memorize long answers. This should be very natural. Your English level should be at a comfortable level that you do not memorize anything before the exam. Whatever the situation is, it's a conversation. Your speech should change according to the patient. Whatever the patient is telling, you have to flow with it. Do not memorize anything before the exam for the speaking test. Anything the assessor or the examiner thinks has been memorized will not be assessed. When you memorize something, it is very, very obvious, and that part of the conversation will not be assessed. Use varied vocabulary which matches the need of the patient and the context of the role play. You need to show you can communicate with the patient in a variety of ways. Speak loudly, clearly, and confidently so the interlocutor can hear you. So be clear, precise, speak loudly and confidently. Pronounce word as clearly and correctly as possible. So this is important. Before the exam, you should practice the correct pronunciation so that the patient, it's always important to pronounce correctly, not just for the exam, for your future as a medical doctor in any countries where the first language is English. If you pronounce correctly, you convey the message more effectively. So pronunciation is very important. For any unknown or new words, look at the correct pronunciation as a preparation for this exam. Vary your intonation. So do not talk in a monotonous voice. Show empathy and do not be monotonous. Your voice should rise and fall as a native speaker's would. If you are not a native speaker and if your speech is memorized, your voice will be monotonous. You'll speak like a robot. But if you're very fluent in English, then you would speak just like a native speaker as if it's your first language. Read the role play card carefully so you do not misunderstand or miss out any of the topic or bullet points. Make brief notes for each point on the card. Include ideas and examples but not full sentences. So when the examiner gives you the card, make small points or write small notes, but do not write an entire question that, okay, I will ask the patient about her symptoms, her anything. Just write SX, symptom. I'll ask about symptom, but do not write long or full sentences because the card will be given back to the examiner. And also you do not have time to write full sentences. This does not show confidence. It shows that you are nervous and you do not know, you are not being able to think about what to ask. Try not to be nervous. Take a deep breath, smile, and make eye contact as you begin your speaking test. So it is important to make eye contact. Do not frequently look at the paper, look at the patient. While eye contact is not assessed, it helps you to feel more confident. Underline the keywords and phrases on the card to assist you with the role play. So when you read the card, underline the keywords like the disease or the diagnosis or what treatment or medications you're supposed to talk about. Underline it so when you're starting the role play, when you look down, your eye clearly goes to the main points. Don't be afraid to ask the interlocutor to clarify anything on the role play card which is unclear. If there is something which is unclear, you can ask the examiner during the 3 minutes before the examination begins. This can include the meaning or the pronunciation of vocabulary and the context of the role play. So you can ask the meaning and also the pronunciation of anything you do not understand. Ensure that any questions are asked before the role play begins. The speaking test will take approximately 20 minutes. You will complete 2 role plays and will talk to the interlocutor for 5 minutes during each role play. You will have 2 to 3 minutes to prepare for your role play using your role play card before each role play begins. So there will be 2 role plays and there will be separate cards for each. The speaking test will be in total approximately 20 minutes, 2 role plays, and the speaking conversation will be for 5 minutes for each role play. And before, you get around 2 to 3 minutes for preparing. The first step in the speaking test is to familiarize yourself with role play card. You will only be given 1 role play card at a time and you will not be given the interlocutor's role play card. So you will only be given the questions or the card for you. You won't know the patient or the examiner's card, what is written. So you do not know what to expect. You don't know what the patient will ask. So you have to be very confident. You only know what you are supposed to ask, but you do not know what your patient will reply. Be aware that the interlocutor's card will include information that is not included in your role play card. So the card you're given will not fully prepare you for everything the patient will say, though it should give you a good idea of the outline that the conversation will take. So, recognize the patient. Who is the patient? The first thing you should identify is the type of patient you are going to talk with. Role play cards will inform you of the key details about the patient and the reason for their appointment. You may also be told about the patient's emotion, like in the card they might ask the patient is sad, the patient is angry, the patient is frustrated. So you have to recognize what your patient has and what emotion they're in. You should take all of these pieces of information into consideration and plan your approach accordingly. For example, if a patient is nervous or worried about a procedure, you will need to offer them reassurance. For example, if it's written in the card that the patient is unsure or is nervous or is worried, then in your conversation you have to reassure the patient, like, it will be okay, I'm reassuring you, you'll be fine, there is treatment for this disease. So such kinds of sentences should be in your conversation. What do you need to find out? Next, look at the bullet pointed task. At least one of the tasks will ask you to find out information from the patient. Identify what it is that you need to find out from the patient and think of ways to rephrase the task into a question that would be appropriate for conversational English. So you'll be given bullet pointed task and they will ask, find out about the lifestyle of patient. So you have to think of questions like, we will ask, so do you do exercise during the day? Do you smoke? What's your favorite cuisine? What do you like to eat during a day? Is it like junk food, or does he like to eat vegetables and fruits? So you have to think of questions to ask according to the bullet points. Take another 30 seconds to think about rephrasing the information in the first bullet point of your role play card to turn these into appropriate questions. Your initial question should be an open question. For example, how are you feeling? So use open-ended question to start the conversation. So how are you feeling? Which should be then followed up with more closed examples, closed question. For example, how long have you been experiencing these symptoms? So when you start with, so how are you today? How have you been lately? How are you feeling? When the patient says, I'm tired, then go to more specific questions like, so are you feeling tired all the day or particularly after work? What do you need to tell the patient? You will be required to provide your patient with necessary information about their condition, tests, and course of treatment, and should ensure that the patient understands the information. What you need to communicate to the patient will be outlined in the bullet points of the role play card. You may simply need to explain a point to the patient, or you may need to find out relevant information first before tailoring your response to patient's individual case. If you have a lot of information to communicate with the patient, you should break the information down into sections so that you can check the patient's understanding for each section of information before moving on to the next section. So, at first, you need to provide your patient with necessary information about their condition. So, when you talk to the patient, you have to give a little bit information about the condition. For example, in our role play, we saw myocardial infarction or heart attack. You can give a little bit information about heart attack. When does it occur? How did it happen? If it's written in your bullet point cards. What you need to communicate to the patient will be outlined in the bullet points. You may simply need to explain a point to the patient. If it's written that please explain what is a stroke or explain what is a high blood pressure, then you have to explain a little bit about high blood pressure or stroke. Or you may need to find out relevant information first before tailoring your response to the patient's individual case. If you have a lot of information to communicate, then you should break down. So if in the card there is a lot of information, if it's written that explain about heart attack, explain about the medications, how it works, then you break it down, outline it, that okay, at first I will give one line about heart attack and then I will explain how the medications work. So you can break it into chunks. Speaking in English. Once your planning time is up, you should have a good idea of the structure your conversation will take. When speaking, you need to cover the following for linguistics to make sure that you are showing the assessor your ability to interact effectively. You need to show that you have a meaningful conversation. You can have meaningful conversations with others in English. So what you speak should be relevant and should be meaningful. You should communicate confidently, take control of the interaction, lead the topic of conversation, and effectively complete the speaking task by addressing all of the points in the task card and responding appropriately to the patient. While it is not essential that you cover all of the information in the 5 minutes provided for each conversation, you should not waste time or talk about points not mentioned in the role play card. So this is important. Don't lose track of conversation. Do not ask irrelevant questions. Try to stick to the bullet points written in the card. To score well in these criteria, you need to communicate in a way that can be easily heard and understood. The assessor or the examiner will pay attention to your pronunciation, the rhythm you use when you speak, the stress you put on individual words, your intonation and your pitch. Avoid memorizing large chunks of speech before the test, as this will sound unnatural. Instead, speak at an appropriate speed and clearly, so be clear. Allow your voice to rise and fall, so when you reach a natural level of speaking in English, you automatically speak just like a native speaker. Your voice will rise and fall, and then you will be more calm, and you can speak in a calm nature and clearly. Practice pronouncing words in English so that they sound the same as when a native English speaker says to them. To address the first bullet-pointed task in the role-play card, you could say, "Tell me if you have had any issues following the diet that we discussed at your last appointment." The words shown in bold in the sentence above should be stressed, as they are the words which carry meaning in the sentence. So, for example, put stress in the bold words. Tell me if you have had any issues following the diet that we discussed at your last appointment. So put stress on the words with meaning. Stress is a slight increase in volume and slight increase in the sound length. So tell me if you have had any issues following the diet that we discussed at your last appointment. Fluency. This criterion addresses the rate and flow of your speech. You need to speak at an appropriate speed and carefully. Think about the sentence you're going to say before saying it, rather than saying something that you later need to correct. You should avoid overusing filler noises like So these are filler noises. Try to avoid this. Think before you speak. And focus on speaking smoothly, linking your speech together and pausing appropriately. For example, you might pause to separate different points you're making. You could say, for example, first, we need to address your diet. Then, so put a pause there instead of saying, pause. Do not make any noise. Do not make filler noise. These are called filler noise. First, we need to address your diet. Then we look at more invasive treatments. You can also pause for emphasis, or before beginning a new task on the role play card, giving yourself a moment to think about what you will say next.
How is the quality of the picture? Do you have my screen on your computer?
It's clear.
Okay, great.
Yes.
Great. Okay, now this is the first day of our course. We will study and we will practice OET, and we will know what occupational English test is in details. Which version of OET we need? You know, OET has different versions according to the specialties, according to the profession. For example, there are some differences between medical OET, I mean the test of OET for medicine professionals, and for example, nursing um, or veterinary sciences. So there are some differences, and because you all are doctors and you will attend in medicine OET, that's why we will work on this version. So OET can be taken by healthcare professions in any of the following 12 professions. But among all these, we will concentrate on the third one, I mean medicine. Okay? Now, and like IELTS, there are 4 sub-skills in OET tests. Edel, would you please tell us what sub-tests do we have in OET? Edel?
Sorry, I couldn't understand.
Would you please tell us how many sub-skills, sub-tests, sub-skills we have in OET test?
We have 4 subtitles.
And what are
divided
they?
into reading, listening, writing, and speaking.
Okay, so it shows that here, I need to confirm again if my voice is quite clear to each of you.
Yes, it's clear.
Everybody happy with the voice quality?
It's fine.
It's okay for me.
Great, okay. Peace of mind for myself. Okay, so here shows that reading and listening is equal and relevant to all 12 healthcare professions. So there aren't many differences between reading and listening. There are some differences, but not that much significant. But about writing and speaking, whatever we study now mostly covers nursing and medicine, while we are concentrating on medicine. So when you are writing, you are writing as a doctor, as a medical profession, not like a nurse, because it's different. Okay. And what do we have in details? Each of these we will practice later, but your mind should be quite ready and quite organized to know that when you are sitting for the test, you will pass this process. So your mind should be quite organized and you should memorize this. Actually, you don't need to memorize, because during the tests and practices, you will be, you will adapt yourself with this condition, with this situation. For listening, you will have 40 minutes. You will listen and understand a range of recordings on, okay, we will have 10 minutes. Whenever the window of Zoom is closed, when the time is over, please join after. I will write in WhatsApp group, or I will inform you We can have 10 minutes break. Actually, maybe now we don't need because just we had fun up to now. So it's better to go move further. Okay, so for listening part, we have 40 minutes. We will listen and understand a range of recordings on healthcare topics from different healthcare settings. For example, it might be about a communication between a doctor and a patient, or doctor and a nurse, or doctor and another medical professional, or a communication between two doctors in workplace. Okay? For reading, you will have 60 minutes. You will read and understand various texts on healthcare topics from different healthcare settings. For writing, how many minutes do you have time? Ichlal, how many minutes do you have time for writing test?
45 minutes.
Yes, exactly. And what will you be evaluated for? How you will be evaluated? Would you please read it?
Okay, write a letter, usually a referral letter using information provided in patient case notes.
Okay, so for your writing test, you will have a case note. A case note will be given, and according to that case note, later we will speak about that, that you will find out and you will highlight the most relevant information. You will pick those information and you will write in your own word, okay? Then your mastery on English, your mastery in linguistic will be evaluated. They will check if you, how you are communicating academically in medical field. Some aspects of you are very important, and during our practices, while you learn how to write, then we will practice and we will have our feedback to improve our English in our writing. I know that most probably most of you have referral letters or transfer letters or discharge letters, or mostly you may have referral letters or information, some information for even patients or their family. You may write in Turkish language, don't you? You have that.
Yes. Yes.
But you will you will write in English. So it's a very, very good practice for each of you to write the same letters in English. So whatever you have in your workplace, try to write it in English as well. This is the best practice. But in a specific structure, an academic structure you should write in, okay? Well, let's move to Kulsum. What about speaking? How much time do you have for a speaking test? Kulsum, would you please tell us how much time do you have for a speaking test?
20 minutes.
Yeah, 20 minutes. And what will you do during that test?
Communicate with a patient in a real-life context through the use of role plays.
Okay, so you will have role play. They will give you two role play cards. In each card, they will ask you, you will be requested to have a role. Usually you will be a doctor and you will speak and communicate with a patient or with a relative of your patient. Usually it's like that. So we will practice on this one as well. It's very important, you know, totally you will receive information from, let me know how much time do we have. Yeah, okay, 4 minutes still. Well, while you have listening and reading, you will receive information, and according to that information, you will answer the questions. But in writing and speaking, you will produce your own information. Okay? They will give you some tips, some you know, some guidance, and you should produce your own word. You should talk in your own word. So you will use your medical information and you will use some tricks that I'm going to teach you. You know, even sometimes you will be in a hard condition. I will teach you how to jump out, how to move from that hard condition. For what? For getting a better score, a better range of the number. Okay. And now, how the scoring is. Nasli, would you please help us? What are the ranges of scoring? For example, in previous grading of OET, we had A, B, C plus, C, D, E. Okay, but now, newly, the new format is the number. For example, EA is equal with how much, Nazli?
Sorry, please ask me again.
Okay. What is, how much the range of scoring is the new format of previous grading? For example, if you say, I need to get A, what range of score you may get?
Okay. If I want to get A grade, I have to take from 450 point to 500.
So if they give you in new format, they may give you, for example, you may get 455. It means that you got A. So in your application form, for example, you have applied to move to UK. If they say in your application that you need to have B, okay, and above, if you have taken, for example, 351, it means that you've passed. Okay? Mm-hmm. But what is the meaning of each score? In what level you're supposed to be? Be careful. For example, I think most of you need to get B, don't you?
Yes.
Mm. What does it mean? It means that you're supposed to be to have.
Can you rate the pain 1 to 10 for me, please?
Okay, perfect, cool. So, I mean, can you write? I mean, you know something?
Rate.
Okay, rate. Okay, can you rate? the pain, okay, level.
Yeah.
A scale, okay, of 1 to 10. All right, so that is it there. But in a very simple way, always start like this, okay? It will be very good for you. On a scale, okay, on a scale of 1 to 10, okay, how would you rate the level of pain? Okay, so that is also a way of saying this. On a scale of 1 to 10, how would you rate the level of pain? All right, perfect one there. Can you rate the pain from 1 to on a scale of 1 to 10? Perfect. Thank you. Furkan, any question we can ask in this situation?
Does the pain radiates from another locations other than your chest?
Perfect. Okay, so does the pain radiate from other locations? Okay, other locations other than your chest. Okay, yes. Thank you. Perfect one there. Like these questions. Okay, Batuhan Aiden, any other question?
Hello. I think I'm not qualified enough to ask questions because nothing comes to my mind right now.
Nothing.
Yes, my friends were so many questions and
yeah, and you are surprised. You are surprised what they are doing, right? Okay, no worry. Yeah. They are doing quite well. Okay, I don't think you should think too much. You should not think too much. Think very basic, right? She is sweating at night. She's not able to eat well. She's waking up as many and 5 times. I mean, there are a lot of questions. Okay.
Well, I'm trying to think simple, but I don't know. I'm just at the second grade.
Yes,
but I can ask. But I can ask. Why don't you eat that much? Or I don't know.
You don't know. Okay. Why can't you eat that much? All right.
Yeah.
So we are talking about eating. So what is the meaning of the word ishta in English? Ishta.
Well, I don't know. I can repeat it.
Ishta.
Ishta. Yeah. I don't know.
In English, appetite.
Yeah, appetite.
Okay. Yes. So that is appetite. So when she says she cannot eat well in the evenings. Gun içerisinde işten var mı? How are we going to ask this question?
Why don't you have a good appetite?
Okay,
and you can eat.
In the daytime, okay, gun içerisinde. All right. So do you have sorry.
Do you have any problems with eating, or do you have any problems with? Why do you think you have problems with your appetite? I don't know.
Why do you don't know? Okay, you just go. All right. At least you try them. All right.
Thank you.
Okay. So that's cool. Do you have appetite? Okay. Appetite. Let's say food. All right. During the daytime. All right. The daytime is a question we are asking. During the daytime, do you have any appetite for food? Asked. Okay, so Batuhan got stuck there. Any other question? Metahan is there. Hussein is there. Ahmed Farouk. If you have any question, you can try. Yes, Metahan. I think you have one.
I don't know. Is it true that have you ever diagnosed some kind of chronic diseases?
Thank you. Okay, so have you ever diagnosed? This is a reason why we are doing this now. Have you ever diagnosed? We cannot say have you ever diagnosed. What is it supposed to be? Because why? Because I am not, or the person you are talking to is not the person who diagnoses herself. All right, it's another person doing this. So this must be the passive one. Okay, so have you ever been diagnosed?
Oh, yes.
All right.
That's
so
correct.
Have you ever been diagnosed with any chronic diseases? All right. Any chronic disease? All right. Okay. So have you ever been diagnosed with any chronic disease? Thank you. Perfect one there. So take note of the being here is a passive because it must be in a passive for this particular question, right? Have you ever been diagnosed with any chronic disease? Perfect. Thank you so much. Elif Kubra, any question you can ask this woman?
Hi, are there any drugs, is there any drugs you profusely use?
Okay, are there, are there any drugs? Any drugs?
You profusely use.
You use profusely. Oh, okay.
Yeah.
Oh, you've tried to use the word profusely. Okay, okay. But I mean, the easiest way could we look at this one here. Are you on any medications? Right? It's the most easy way, Katie.
Yes.
Are you on any medications? When you say, are you on any medication? It means, are you taking any medications? Right? So are you on any medications here? Perfect one then. Thank you for that one. Nice. Becca too soon. Any question here for us?
We may ask, have you experienced anything unordinary that happened before your pain?
Okay, so have you experienced anything out of the ordinary, before the pain? All right. Have you experienced anything, maybe an accident, you fallen from your bed, anything, out of the ordinary before the pain? Thank you. That's also nice, nice one there. Hussein, any question we could add to this list?
Yeah, I have. Firstly, we can ask the patient, are you smoking?
Okay, so are you smoking is a very, very, general broad statement used mainly when we are talking about what? The simple present continuous tense, present continuous. When I say, are you smoking? It basically means shimdi sigara shiomusu, all right? And the bed shimdi ichmio, all right? So what do you have to say? Do you smoke? Okay,
Okay.
Okay, so we don't say, are you smoking cigarette, but do you smoke? Okay, do you smoke? All right, so that is one thing here we can ask. All right, now let's quickly move on to the next one here. Do you smoke? Ahmed Farouk. Ahmed?
Yes.
Yes, any question?
Does your chest pain increase with an effort or decrease when you sit and rest?
Okay, that's your chest pain, all right? When you say increase, we in medical term, that is a word and we use early on, by Bashak, we said exacerbate, all right? Okay. In medical English, we generally use the word exacerbate or alleviate, with any actions. That's a question. Okay, so does your chest pain exacerbate or alleviate with any actions? Does it go down or go up with any action, any form of movement, all right? Like sitting, or doing anything. So that is how we are going to ask that question. All right, I think basically everyone has tried to say something. That's good. At the end, can you please explain the question 10? All right. Oh, sorry, I really, have you experienced? Okay, have you experienced almost Lazim Metahan? So have you experienced anything out of the ordinary before the pain? Basically in the past, before you started feeling like that, did anything happen to you? Did you have an accident? Did you hit the floor? Did anyone punch you? Because we are asking this question, to check what may be the cause. It may be a very basic situation of house abuse, right? So domestic abuse basically means maybe her husband punched her, all right? It could be like that. That's why she's feeling the pain. Anything could be, possible. So have you experienced anything out of the ordinary? When you say something's out of the ordinary, it's not an, normal thing that happens every day. So that is it there. I hope I explained it well. All right. So I mean, that is it there. So, I mean, we've all come up with these kind of questions here. One thing we notice is this. Most of the questions we are asking here deal with the past, okay, the past questions, and we also use the present perfect a lot. Have you ever? Have you ever? Okay, have you experienced? That's your chest, okay? So it is obvious that most of the time, the tenses we use more, often when we are asking questions at doctors are these tenses, okay? I mean, simple present tense, present perfect, all right, are very, very important. And of course, the simple past tense. We have to know these tenses in and out when we are asking a question, especially when you're asking something that is very general, like, do you smoke? All right. I mean, if we don't want to put it, do you smoke? You can, are you a smoker? Okay. We can use it like that. I mean, what is the name given to a person who doesn't drink alcohol? Anyone? Okay. I mean, are you an alcoholic? Alcoholic is not someone who drinks alcohol. Even an alcoholic that has been gotten out of board, all right? So a person who is not an alcoholic person is called a teetotal, someone who doesn't drink alcohol. It's a teetotal. So if you're a teetotal, that means you stay away from alcohol. You've never tasted alcohol, okay? So take note of that. So you can simply ask the question, are you teetotal? But one thing I realize most in this particular session is you guys didn't ask anything about family history, all right? Family history was not asked at all. And one thing you always have to ask is what history of the patient. That is very, very important, okay? Do you have any history of heart diseases in your family? Have you ever felt like this in the past 10 years? Have you seen any doctor about this? I mean, you didn't ask anything about the patient's medical history. And I was quite disappointed about that. So medical history could have been asked, all right? So let's quickly deal with this one here. Let me check how you guys are going to answer these questions in this particular way. Come up with something, okay? Just come up with, something here to explain what this patient is feeling. Now, if I should ask you, Bashak, for example, may you describe the pain you experience? How would you put this explanation? May you describe?
Okay. Well, any kind of description, you
yes,
mean?
Any kind of description on pet chest. Yeah.
Okay. Well, I can tell you it's like a stabbing pain. It comes and goes. I can tell that.
Okay. It's like a stabbing pain. It comes and goes. All right. Which part of the chest do you feel? I mean, right in the middle, the left side, the right side?
Around the middle, but it radiates towards the left.
Okay. How often does this chest pain occur? What's the time interval?
It happens after I eat, or it happens when I get to the cold air. If the weather is too cold, my chest starts to ache.
Okay, so does it happen a lot indoors? I like the way you're doing this. Does it happen a lot? Does it happen sometimes indoors?
I couldn't hear you, sorry.
Does it happen sometimes indoors, like when you are at home?
Well, she's always indoors, so yes, when I'm indoors. But to be honest, mostly I only watch TV at the home. But if I'm doing something like if I'm cleaning the house or etc., if I move, the pain gets worse.
Oh, okay. So the pain gets exacerbated with movement. All right, like that. Okay, so I like what you
yeah, just... I'm trying to be something similar to Madame Fatima here.
That's impressive, though. That's impressive. Okay, and this is one part you guys are going to face in the OET exam, guys. Okay, you're going to have a role play, and this role play, most of the time, of course, you're not going to be the patient. This time around, you're going to be the doctor asking questions, right? So that's what we are trying to portray in this particular circumstance. And Bashak equally did a great job. Now, my focus here is not about the role play because that's what we're going to practice a lot. Later on. My focus here is how you are going to ask the questions, all right? Especially when it comes to the passive structures, the present perfect structures, and here. Now, if you realize what I was doing, I was asking Bashak the questions from the answers she gave me. So every time she says an answer, I get a question from the answer. That is exactly something you have to try and acquire, a skill that is really, really important for this particular exam, especially in the speaking part, right? Because when you're doing a role play and there is a patient sitting in front of you, you've got to ask very salient questions, very critical, important questions for the patient to answer to lead you to the diagnosis, right? So that is very, very important one here. Now, let's add an extra, information to Fatima's case, all right? We have learned that why did you come all the way to Ankara for examination? What could be the reason why a person could come all the way from Shafak, may you answer like Fatima? Why did you come all the way from Yalova for
Okay. Because I heard that you are one of the best doctors, best heart doctors,
cardiac in Ankara.
Cardiac doctors in Ankara. And there are not many good doctors for this particular specific for cardiac.
Okay,
there's no yeah, you get me.
Okay.
So I came all the way here for you.
Okay, you came all the way here for me because of my expertise in the field. Okay.
Yeah.
This is exactly what you want to say. I came here. Okay. I came here because of your reputation. That's the word you're looking for.
Okay. Yeah.
Because I heard that you're one of the best. All right. Means your reputation. Okay. So when you say reputation, what does it mean? Itibar. Basically how people know you. So I came here because of your reputation. I came here for your reputation. That's exactly what you wanted to say. Perfect. Okay. So you came here for your reputation. That you have a very good reputation. And I hear you are one of the best in this field, right? One of the best doctors in this field. And you make that statement also very correct. All right. That is it there. Perfect. Thank you, Shafak, about that one here. Now, let me quickly ask this one here. Okay, so we have asked a lot of questions here in this sense. Now, is there any of the tenses you don't understand? Present simple, present continuous, any of the tenses that confuses you? You have any of these tenses that confuse you, please may you raise your hand or write something in the chat box. Let's see how best we can deal with a whole lot of examples to deal with it, because I don't want us to have tenses issues ahead when we start doing the real cases. Any tense problems? Present perfect, present simple? No, I guess. Okay. Present continuous, perfect continuous, okay. Apart from perfect continuous, any other one? All right, perfect. Okay, so let me quickly explain the perfect continuous here in this particular session. And when you're talking about perfect continuous tense, what does it mean? Okay, generally the perfect tense is used to talk about something that happened in the past, but still has an impact on the present, right? It has an impact. When I say impact, I mean effect and influence on the present. That's a perfect tense, right? Now, what is a perfect continuous tense? Perfect continuous specifically defines something that happened in the past and it is still continuing in the present. Once again, I'm explaining something that happened in the past and is still continuing in the present. That is why we use a present continuous. We call it a perfect continuous. It happened in the past, is still continuing in the present, okay? Now, as you know, or as you may already know, every continuous tense in English has or uses the ing structure, right? So we use the ing structure when you're talking about a present perfect continuous tense too, right? Now, if someone comes to you, and asks you the present perfect tense, okay? If you're going to ask a person here, one of the major, okay, here, questions we ask is this. Number 2, how long have you been experiencing this chest pain? How long have you been experiencing this chest pain? Why do we ask this question? We ask because it started in the past and it's still continuing. So how long have you been experiencing? How long did you experience have you been experiencing? We can sometimes also ask this one here. Now, how long have you been feeling? Okay, like this or like that. Okay, how long have you been feeling like that? Now, why are we asking here? Because we use the structure, have you been? The structure of the present perfect tense, okay, continuous tense, always go what? Have or has plus been, okay, plus verb ing. This is a structure we always have to use when we are going to use it. Present perfect continuous, all right? So, when talking about something. Now, I have been, okay, coughing blood since last week, Tuesday. All right, I've been coughing blood since last week, Tuesday. What exactly does it mean? It means last week, Tuesday, I started coughing blood, and until now, it is still continuing. Whenever I cough, I see blood in my, in my cough, right? Or from my cough. So that is it there. Now, I have been excreting. Excrete means to, the technical word, I guess you know, okay, to use the, go to bowels, all right? So excreting, or I've been excreting dark, okay, brown bowels, right? Okay, for the past 3 days. So here we're talking about how the person has been feeling over the past 3 days. Okay, it started in the past, it's still continuing, and the structure is have been, excreting, have been, okay, plus verb ing. So that is how it is. So here we've got cough, we have excrete, right? Those are the words we're going to use. Okay, now let's quickly, here. Say, Mr. Okay, Yilmaz has been complaining. Okay, Mr. Yilmaz has been complaining of, okay, Mr. Yilmaz has been complaining of what? Let's say, okay, sleeplessness. Okay, has been complaining of sleeplessness for a month. All right, so here he has been complaining because it has been. So the has only uses the he or she. Okay, I have been. Okay, so here all these situations happen in the past and they're still continuing. Okay, present perfect continuous is simply like this. Why do we use the present perfect continuous if it can have the function of the present perfect tense? Of course, some of the tenses can have the function of the present perfect tense, but it does not always stay like that. So always know the structure you use when you're talking about the present perfect continuous is really, really critical. Okay, and the question always should be on point. Okay, how long have you been? What have you been doing? Okay, what have you been doing since it started, for example? All right, so what have you been doing? Okay, yani başladığından beri şu ana kadar. It's different from what have you done? Okay, all right, they have different structures. So what have you been doing? I mean since you started, okay, since you started feeling like that. Okay, in the same way, what have you done since, okay, you started feeling like that? These are book sentences you should be really, really aware of. Basically, I mean, similar, but not exactly the same, right? So if someone is asking, one is asking about what you have done exactly from the time it started, the other one is asking you what you've been doing from the time it started. Okay, critical. All right, so I hope you got it. Dilara, could you get it? Yes, all right. Okay, glad to know you got it. Okay, so that is a present perfect continuous, okay, and I presume there is no other tense in this list here. Okay, you are, suffering from. I presume so. All right, let me take a screenshot. Maybe it can be sent to your group later. Now, one problem I think most of, you, especially because it's not a very, very common thing we use in English, suffer from is the passive, all right? The passive voice. Yeah. Okay, so iPhone user, who are you, by the way? What's your name? Couldn't get a difference between the present perfect and what's your name? Can you mention your name? Zainab. Okay, perfect. Okay, so Zainab couldn't really get a difference between the present perfect and the present continuous. All right. All right, let me quickly analyze it here. So, the present perfect and the present perfect continuous basically have, similar functions, okay, in some cases. Similar functions in some cases. But let me quickly give you a very, very simple example, all right? Now, what are the main uses of the present perfect continuous, right? Present perfect continuous is mainly used for something that happened in the past, okay, and it is still continuing in the present. Not just an effect, it is still continuing. Okay, so Zainab, take note of this. It's still continuing. Zainab, let me ask you a very simple question, okay? Okay, someone Okay, so Zainab, look at these two sentences. Do you think they are the same? And did I lose her? I hope I didn't. Oh, I have lost Zainab. All right. So, when you're talking about this one here, in these two sentences, for example, okay. So now what is the difference between these ones, these two sentences?
I think someone has been eating my chocolate. It means he started or she started eating and still eating right now.
Mm-hmm.
And the top one is someone ate my chocolate in the past.
Okay.
And now the chocolate is gone.
It's gone. All right. Okay. So, all right. So, what if someone ate my chocolate in the past? Why didn't you just say someone ate my chocolate? Why have you said someone has eaten my chocolate? Why didn't you just say ate my chocolate?
Maybe I'm not sure of it. Maybe I'm lost. I don't know.
You're not lost. You're right there. Okay. And this is a confusing bit, okay, of the present perfect. I mean, for most Turks, because in your language, you don't have exactly anything like this, right? Now, what is the main reason why we use a present perfect tense? Okay. Let me quickly explain this to you, and hopefully you are going to get this one better. All right, so the present perfect tense mostly is used to what? To, discuss or talk about, discuss or describe, okay, recent actions, right? So when you're talking about recent actions, what exactly does it mean? Something that happened recently, all right? Don't forget the main idea of the present perfect tense. The main idea of the present perfect tense is to what? Used to talk about, okay? The present perfect tense is used to describe, okay, things that happened in the past, okay, but still has an effect. Right. So that is it. That things that happen in the past but still has an effect on the present. So that is what the present perfect is used for. Now, if you use to describe recent actions, that means something that happened in the past, but it's recent. All right. Now, if I am saying here, I have clapped, I didn't clap, because now once I do this, it is past, it's gone, but it is recent. So I'm going to say what? I have clapped. Why? Because the impact, the effect is still ongoing. Maybe I'm clapping for you, the person I'm clapping for still feels happy. In the same way, just like Senna explained, someone has eaten my chocolate. If I say someone has eaten my chocolate, it basically means someone has taken my chocolate and eaten it. It's gone, but I still feel the pain. It's kesiva. When I went there, I couldn't find my chocolate. I'm still sad about the situation. All right. If I say someone ate my chocolate, I have to be specific. I have to say someone ate my chocolate 2 days ago, 3 years ago, 5 months ago. I have to be very specific. 2 minutes ago. If I'm not specific, I cannot use the past simple tense. But if I use the present perfect tense, it means it's a recent action. On the other hand, someone has been eating my chocolate means has been a continuous action that started in the past. On Monday, I put my chocolate there. When I came, it was gone. On Tuesday, I put my chocolate there in the fridge. When I came, it was gone. On Wednesday, the same thing happened. On Thursday, the same thing happened. Someone has been eating my chocolate. All right? Every time I go into the fridge, my chocolate is gone. Someone has been doing this over and over again. All right? So take note of the two. The same way, if you bring into the music, let's say medical arena, okay, there are some conditions that happen only once, all right? So for example, I have broken, let's say my son has twisted his ankle. My son has twisted his ankle. Twisted ankle. What is twisted? What do you say in Turkish? Burukmakma?
Burkulmak.
Burkulmak. Okay. So that is my son has twisted my ankle. Now, I cannot say my son has been twisting his ankle. It's impossible. He must be a fool to do this all the time. There must be something wrong with him. This sentence, there is something wrong with it. If he has psychological issues and he loves to twist his ankle, that's a different thing altogether. But it's almost impossible because it's just the first one is just one action. Now, the action happened in the past. He has twisted his ankle. Now he's in crutches. He's holding the crutches to walk. Okay, because his ankle is not active anymore. It's not working. The second one, when son has been twisted his ankle, means he did it in the past, okay, and it has happened a couple of times, which is not very, very sensible. All right. So in a situation, based on the situation, we use a present perfect or the present continuous, based on how often the situation has occurred. Okay, the same thing. Okay, I have cut myself. Okay, I have cut myself. I mean, if someone tells you this, I have cut myself, kendimi kestim. Automatic olarak, you are going to ask me, the person, ne zaman oldu? Nasıl oldu? All right? How did you cut yourself? That's an automatic question. But no one is going to say, I have been cutting myself. You don't say that. Unless maybe you're suffering from a disorder. Okay, you have borderline disorder or something, you still keep on cutting yourself stuff. That's a different thing altogether. All right. So I have cut myself. It's of one situation here, right? But if it is a continuous thing happening, for example, my father has been vomiting. Now, we have seen this word vomiting. Yeah, sorry, vomiting. Okay, since last night. If I see here, my father has been vomiting, automatically you understand it is not once. Be careful, Omar. All right. Be careful. Man, my father. You can say my father has vomited. Sorry. Vomit word means kusmak. Right. So my father has vomited. Here it happened once, but in the past, it's finished. So these are basic, time. So basically, when you're talking about a continuous tense, it is talking about the continuous action of something that started in the past. That's it, right? So just like we cannot say someone has been cut, someone has been twisting his ankle, which means, okay, it's always continuous, okay? The same way when we use once, all right, then we means that, okay? So here, if someone tells you, I have been taking some medications. Look at this one here. I've been taking some medications, okay, for the headache. If someone tells you this, all right, I've been taking some medication for the headache, it means what? Since the headache started, I take some pills, I take some things for the headache, all right? I have been taking some pills. That means I'm still taking the pills. I started in the past and I'm still taking it, okay? If someone tells you, I have taken, okay, some medication for the headache, it basically means what? I took one medication for the headache and that's it. I've not taken any other. I have been taking continuous. I have taken once in the past midday. Why? Because the et key is still there. So generally, the present perfect is used to talk about what? Recent actions, and most of the time one. And by the way, what always confuses people in Turkey most of the time is the present perfect is not only for the recent actions. Okay, it has other uses as well. Let me give you the other uses here. So that maybe it will be much easier for you to remember, at least. Other uses include, okay, used, very simple, okay, to describe what? Recent news, of course. Okay, so recent news, yeni haber. Okay, so we talked about recent news, we use the present perfect. Continuous, so, Prince Philip has died. We don't say Prince Philip died. He has died. It's a recent news. Everyone is talking about it. So it's the effect is still present, right? It's affecting the world. And also used to describe, okay, experiences. So personal experiences. When you're talking about personal experiences, for example, I have been to, I have won, I have done this, I have done this, I have done that. When you're talking about personal experiences, we also use the present perfect tense. Importantly, okay, and we also use to describe, all right, describe achievement. So when you're talking about achievement, things you have achieved, you're succeeded at. I have won several awards, okay. My father, who is a doctor, has performed over 2,000 surgeries, okay. Or the doctors in my hospital, have examined over 5 million patients this year, something like that. Okay, so achievement. The last one used to describe, right, duration. Duration is what you call süreç. Okay, so this is when we use for or since. All right, so since, then very, for, the, right. So basically, duration. These are the five main reasons of the present perfect. right? Now for the present perfect continuous, we are talking about something that happened in the past. It is still continuing. And that is why, okay, we use the ing. The key word is the ing. When you say the ing, that means it is continuing. It is not a one thing, okay? It's not a one-time thing. It is continuing. All right, so I hope it is well explained. Zainab, could you get it? Okay, thank you. I'm glad you did. All right, so that is a difference between this, and please know the differences. It's really, really critical, because in medical terms, the moment you swap these words, it changes everything, the information the patient is giving you and how it's going to be understood. It's really, really critical for you to understand the difference between the present perfect continuous and the present perfect. All right. One thing that also is a little bit confusing for most Turkish students is the past perfect. Past perfect. All right. Now, okay, let's go back to Fatima's case. Let's take a wrong turn. So here, Madam Fatima All right, so let's look at this one here. In this tent here, we've got, this situation. So Madam Fatima had been admitted to a hospital in Yalova 3 months ago for a heart attack. All right, so she had been admitted. Now look at the structure, had been admitted. This is called a past perfect. All right. So why do we use has? Why didn't you use has been but had been? Because it happened in the past and it's a completed action. But this time, because something has come in, another thing is happening, we use had been. Okay. So Madam Fatima had been admitted to a hospital in Yalova 3 months ago for a heart attack. She was discharged. What's the meaning of discharged? What's the meaning of discharge? Anyone with the meaning of discharge, Elif? If you discharge someone for a hospital, what does it mean?
Me?
If you discharge someone from hospital, what does it mean?
Taburcu olmak.
What's tabuchu? Okay.
Leaving the hospital.
That is correct. That is correct. Okay. So yeah. So leaving. So she was discharged, okay, after staying, in the hospital. Oh, sorry, I made a mistake here. She discharged after staying in the hospital. For a week, and so she decided to seek further medical attention from more experienced doctors. Prior to her early 50s, she had never had any problem. Okay, look at this one here. She had never had any problems. Why am I using had never? Because once again, it is not present perfect, it is past perfect. Now, why am I talking about prior to her early 50s? Now, when I say prior means before, all right? To her early 50s, she had never had any problem with her heart and doesn't have any family member with a similar condition, all right? So that is it there. When we're talking about a past perfect, we're talking about something that happened in the past and is completed. So note the difference here. I had not seen him since here. I had not, okay, means what is it different from I didn't see him. I had not seen him before leaving home. Two actions happening, one happened in the past, it's finished, it's completed, then we can use the past perfect. So please take note of these differences very well. It's really, really critical, especially when you are dealing with patients. Past perfect tenses, extremely critical, all right? So this is how the past perfect are also used here in this particular situation. Now, what we are doing here is called contextual grammar. We're not just teaching you grammar based on rules. I'm teaching you through a case so that you can understand it better, all right? So that is it there. Any question about the past perfect? Anyone? All right, I think it is also clear, the past perfect. All right, so past perfect is also clear. Lastly, one thing, okay, one topic we have a problem with most of the time, I think, is the passive. Okay, passive voice. Okay, so passive voice here, man, because you are all, going to be doctors, most of the time you are not going to work alone. You're going to work with a team, and sometimes you're going to get referrals. So what I mean by referrals is other people are going to come to you, or other people are going to come to you from other doctors. They've got to help them. Okay, and in these circumstances, the passive voice is always going to be useful, right? So, something like she had been diagnosed. Just like the question we had, written earlier, she had been diagnosed. If I say she had been diagnosed, that means what? The diagnosis was done by another person, right? Now, why do we use the passive voice and why is it important? It's really, really important to use the passive voice, and why is it really, really important? Okay, let's quickly check this out. First and foremost, in every sentence we have, by this time I think you know this, but very quickly, let me go over it. We've got the object, okay, and we have the subject. What is the subject? The subject is action yapan, what they call the action doer. Okay, the person who is undertaking an action is called a subject. And the object is what? The affected person. Thing or person. That's the object. These are the two main things you should understand in every passive voice you're going to make. So, who is action yapan? Okay, I think in Turkish you use nezne ozne. Okay, I'm not very sure which one is which. I always get confused about that. All right. So the action doer. Now, another thing we also have to look at when you're doing a passive is the verb, okay? So the verb is the action itself. The action itself. So what is the action in question? What action are we looking at? Okay, so that is it there. Now, we use a passive, okay, for two main reasons. When someone asks me, why do we actually use a passive? It's not necessary. If you can use the active, why do we use a passive? The same thing in Turkish, you also use the edigen. Why do you use edigen? If you have the active voice, right? Why is the passive, okay, I'm writing the same sentence, okay, in a passive voice used? Okay, so the passive voice is used for two main reasons. Two main reasons, okay? Reason one. So the passive voice, okay, is used when the subject, okay, of a sentence or in a sentence is unknown. The subject of the sentence is unknown. Okay, so here, I don't know the person who did the object. I don't know. In this situation, how is it very, very important for us as doctors? Because sometimes patients go and see other doctors and they come to you after that. Okay, so I mean, here, for example, let's quickly look at this one here. A prescription, let's look. Was written for me for similar medication 2 months ago. So now look at this one here, a prescription. Sorry, it's supposed to be prescription. All right. So a prescription was written for me for similar medication 2 months ago. Now, who wrote the prescription? We don't care. We don't care about who wrote it. The actor, okay, the subject in this sentence is unknown, but we don't care. And that takes us to the next one. Why the passive is used, all right? So that is going to the next one. The passive voice, okay, the passive voice is used when the object, okay, in a sentence is more important than the subject. Second reason why we use passive. The object in a sentence is more important than the subject. If this happens, then the passive definitely is going to be used because we know the object is more important, all right? So in this one here, if you look at the first example we've given, a prescription was written for me, all right? Now, in this one, the focus is on prescription. Prescription is the object of the sentence. That is where we are looking at. The person who did it is not really important for us. Okay, then we use this passive voice. So why do we use this one here? For example, sometimes you go to the hospital now and go like, I was diagnosed. Okay, I was diagnosed. I was diagnosed with what? Food poisoning. Okay, last week. So here, I was diagnosed with food poison. So here, the main case is what you getting diagnosis, with food poisoning. We don't care about who diagnosed you or what happened to you, all right? So food poisoning here is the main issue. Diagnose is the verb, okay? And you being diagnosed. So I becomes what? I becomes the object. You are the affected person, okay? Once you're the affected person, you become the object. The object where everyone is talking about. The main focus is on you. I was diagnosed with food poisoning last week. So the passive voice is very, very critical. when you are doing anything, man, don't forget to know the differences between this one here. Okay, so what are some questions, all right, we can ask? Okay, have you been diagnosed with blah, 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 right? Because I'm not going to ask you, has any doctor diagnosed you with blah, 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 all right? No, it's not important for me, and whoever did that. So have you been diagnosed with anything, all right? So this is what we say, okay? Have you? Okay, so have you been on any medication? Have you been put on any medication? If someone asks you whether you have been put on any medication, basically they're asking you if any doctor has prescribed any okay? I mean, anything for you, all right? So take note of these ones here. Have you been attended? In this mean to by anyone, someone attend to you. That means they look at you, they come and ask you questions really regarding your issue. Okay, have you been attended to? Or not has you, but have you, sorry, have you been attended to by anyone? That means, has anyone come to your aid? Has anyone come to help you? These are the basic ones here. So the passive voice, I presume you know how to make the passive voice. That's why I'm not going into details about the explanations, okay, about this particular issue. And these are the three main tenses. You should focus on. I think you know the simple present, simple tenses, past and simple present. So the perfect tenses, perfect continuous, and the passive, very critical. Very, very critical. You have to know these things because from next week going, we're going to do real life cases, all right? And in these real life cases, I would expect you to know the right tense to use by focusing on what we have done today. Okay, so you're going to use the right tenses to get the right answers. I don't want, you to just be mixing up with the verbs because when it comes to from next week, when you start doing real cases, I might not be able to explain verbs to you. So we might run faster. That's why I'm doing the explanation today, right? So if you don't understand anything, please let me know. Now I'll go over again and again so that you can also check it out, okay? So for the last time, let me quickly confirm. Do any of you have a problem with the passive voice? Any of you? Okay, so I presume no. Okay, so I presume no is the answer. So we are through. We are through. I'm very, very glad I don't have to work on grammar a lot. Right, so we are through with we are done with these tenses. Passive voice, okay. Not perfect, but perfect. Let me say tenses in general. Okay, we're done with these tenses here, and I presume we don't have any issues with these two, right? So we are through to go in terms of whatever we have to do. So sometimes in the writing too, we are going to need these ones a lot, right? A lot. We're going to need a lot in the writing, and so we're not just doing these things for speaking. You've got to know how it's done in the writing as well as in the speaking. That's what you're doing this one here. And I presume because your level is high, we don't have any problem with this. Okay. Now, let's quickly. So And now we've done contextual grammar for today. Generally, contextual grammar is going to only, okay, the fact that I've told you, most of the time we are going to come into basic grammatical errors. Sometimes you're going to see these things here. One thing that we also have to focus on is a lot in vocabulary. So once in a while, I'm going to give you a list of words we're going to focus on a lot. For example, today, Bashak reminded us of the word exacerbate and alleviate. These are words you're going to use a lot in your medical history, especially if you intend to use your go to medical school or do your residence abroad. Okay, alleviate and exacerbate. So please take note of these two important figures, words, exacerbate and alleviate. Very, very critical words. Not just these words. One thing we are also going to do in this class, or we're going to be doing basically, is going to go over the short forms and shortcuts, okay, of words. It's also going to be very, very critical. So I have started compiling a list for you, especially for this group, okay? Your levels are quite very, high. So I've started compiling a list for you. The list is going to include the most famous words we might need in an OET exam, okay? We're just going to go over it like that, all right? So take note of that. Now, I've introduced you to speaking today as well, okay? Considering how you are going to be asking questions and answering them. Now, in our next, most of the cases I wrote today are not real. I just made them up, okay? And I just wanted to see how you're going to ask questions in them. And I presume you did a great job, right? One thing we are also going to be doing here in the practice, and one thing you have to know is writing. Now, the writing, what is the writing generally going to be about? The writing is generally going to be about referral. When I say a referral, that means you see a patient and you have an interview with the patient, or sometimes a patient relative, usually the mom, the dad, or the sister, if they're old, or their kids, if they're old people. And after that, you write a report about this patient before you refer the patient. And when you say you are referring a patient, that means you are directing the patient to another doctor who is going to help in what? Bringing the patient to recovery, right? Because maybe it is not your expertise. Maybe you are not an expert in that field. You don't know that field very well. Let's imagine you're a pediatrician and you have a case involving, cardiology. So you have to refer the patient to what? A pediatrician cardiologist, okay? So a cardiologist who is a pediatrician. So cardiologist who takes care of younger children to be able to analyze the situation better, right? That is called a referral. And in the referral, we are also going to, base everything based on our observations of the patient. What are some possible things the patient may be hiding from us? What are some possible things the patient's parents may be hiding from us? So it's going to be really, really detailed. And next week, we're going to, start with the writing section of this, kind of analysis. Okay, so most of the writings are going to be more like, a task-based writing. So I'm going to give you the situation. You're going to take it home as a homework. And when you have time during the week, you will send me an email and I'll correct the right answers and send them back to you. Okay, so that is how our writing is going to be. But you should take note that there's going to be a lot of cases. At least we're going to try to do at least 3 cases in a month, right? Where you refer a patient. I'm going to give you a set of notes. You're going to look at a note and refer. Now, what is one point I need you to understand in this writing? I need everyone to do this writing and take it seriously, because after analyzing this writing, I'm also going to detect if you have any issues with vocabulary, writing, or grammar. All right, so that we can see if there is the need to treat other grammar topics. All right, so that is it there. The earlier the better if you can tap on our mistakes now, because since most of you already speak good English, we don't have to waste time, okay, on other grammar. The other part of reading, the reading is, when done in class, sometimes it can be really, really boring and intimidating. So reading is also going to be task-based. So I'm going to give you some tasks in terms of reading, okay, and we're going to do it. Another thing that is going to be really, really critical here in this class, the main focuses are going to be listening and speaking. Okay, listening and speaking, these two skills, because that is what really, really kills people. So, I mean, in the class, we are going to be listening to cases, and after that, we're going to discuss what is happening. Okay, so I'm going to take you through the course from the very beginning, because initially I thought you would need some, basic understanding of English before we continue, but I presume you are all good. Okay, you're generally good. So I also want you to inform me if you have specific issues regarding your English language. So specific issues, maybe you have vocabulary problem, maybe you have problem with sentences, you have problem making simple sentences or something, or maybe asking questions. If that is your problem, if you have any specific problem, I want them to be outlined to me, right? Just make sure you, last week I sent my email in the chat box. This week, so let me do exactly the same. This is my email. If you have any specific questions, or let me write it on the board here too. If you have any specific questions, okay, specific questions you will need help with, please let me know so that I can, do that, because I don't want to start where I know that some people are behind, all right? We can all move at that particular point and try to make good use of our time in this class, right? So that is it for now. Take note of that. Any questions for today? Any questions? All right. Okay. So our mission for today has been accomplished, focusing on the main grammar to be used in the speaking and interviews, right? So if you didn't understand, please, if you have time, go over. I'm going to try my best to take this, screenshot. I took some screenshot of what we explained in class today so that at least you can go over them in your free time, okay? Get ready, and please, when you come into class next week, come with a pen and a paper, because we're going to do some real analysis, and we're going to do some listening too. So just come prepared next week when you come into class, right? Wishing you a wonderful week ahead, and I hope, I wish you all the best for those who have exams. Okay, I'll see you next week. Take care of yourselves. Bye bye.
Thank you. Bye bye.
Bye. Take care.